So let's start with the abdomen. So at first we have to know what is abdomen, what are its boundaries, what are the contents, and for clinical purpose we divide the abdominal cavity into 9 regions. We have to know the what are the regions and what are the structures in the 9 regions. So let's start. At first, what is abdomen? Abdomen is the lower part of the trunk below the diaphragm. What is trunk? The thorax and abdomen. The thorax and abdomen together is called trunk. So we can say the abdomen is the lower part of the trunk just below the diaphragm, and the abdominal wall surrounds a larger cavity that is called abdominal cavity. We have read the thorax, the thoracic cavity, and abdomen there is also a cavity that is abdominal cavity. The abdominal cavity is subdivided by a plane of pelvic inlet into two cavity, upper larger part that is known as abdominal cavity proper, and lower smaller part that is known as pelvic cavity. So the abdominal cavity is subdivided by pelvic inlet into two parts: abdominal cavity proper, which is upper and larger, and pelvic cavity, which is lower and smaller. Now, so this is the abdominal cavity. Okay, so it is just below the diaphragm. The whole part is the abdominal cavity. Okay, and it is divided into two parts by pelvic inlet. This is the pelvic inlet. By pelvic inlet we can divide the abdominal cavity into two parts. Above there is abdominal cavity proper, and below the pelvic inlet the smaller area is the pelvic cavity. Okay, now come to the boundary. What are the boundaries of the abdominal cavity? The abdominal cavity has roof, floor, anterior wall and posterior wall. Roof, floor, anterior wall and posterior wall. The roof or the superiorly it is formed by there is diaphragm. Okay, and floor or inferiorly it is continuous with the pelvic cavity, and anteriorly or anterior abdominal wall it is formed by some muscles. Okay, later we will discuss detail about the anterior abdominal wall. So some muscles of the abdomen they forms the anterior wall, especially the external oblique muscle, internal oblique muscle, rectus abdominis muscles. These muscles form the anterior abdominal wall. And now come to the posterior abdominal wall. The posterior abdominal wall it is formed by some bony part and muscles and fascias. So the posterior abdominal wall it is formed by the lumbar vertebra, some muscles as well as some fascias. Okay, and two important characteristics of the abdominal wall. The anterior abdominal wall it is firm and elastic. Okay, the firmness of the anterior abdominal wall protects the abdominal viscera as liver, kidney, gut, etc. And the elasticity of the anterior abdominal wall it helps in expansion of the abdominal viscera. So the firmness protects the abdominal viscera, and the elasticity it allows the expansion of the abdominal viscera. And the posterior abdominal wall. The posterior abdominal wall is osteomuscular and rigid. Okay, and because of this rigidity provides support to the abdominal organs. So the anterior abdominal wall is firm and elastic, that means it is expandable, but the posterior abdominal wall is rigid, it doesn't expand. Now, what are the contents of the abdominal cavity or abdomen? We can divide the content into two main groups. Number one is the digestive tract, that means stomach. If we come from the above, abdominal part of the esophagus, stomach, then small gut, large gut, that means ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anal canal, and the number 2 is the urogenital system. That means the structures which are involved in the formation of the urine and genitalia. So the kidney, so in the urinary system there is kidney, ureter, urethra, etc. And in the genital system, in case of male and female, they are different. In case of male, the vas deferens, prostate, etc. And in case of female, uterus, fallopian tube, ovary, these are the female genital organ. Okay, so the content of the abdomen we can divide into two broad heading. The number 1 is the digestive tract, that means abdominal part of the esophagus, stomach, small gut, large gut, etc. and as well as the liver, pancreas, spleen. And the number 2 is the urogenital tract, that means ureter, kidney and male genitalia and female genitalia. Okay, and as well as some important vessels, nerves and lymphatics. You can see this is the inferior vena cava and the red one is the abdominal aorta, and some other important vessels, some nerves, some lymphatics also remain in the abdomen. Okay, so let's see the content. The content of the abdomen is the organ and glands of the digestive system and urinary system. Okay, so among the digestive system there is stomach, small intestine, most of the large intestine, liver, gallbladder, pancreas, spleen. And in the urogenital system, 2 kidneys, part of the ureters, adrenal glands and blood vessels, lymphatics, nerves, spleen and lymph nodes. Okay, so these are the content of the abdominal cavity. And for specifically in the pelvic cavity, what are the contents in the pelvic cavity? In the pelvic cavity, actually within the pelvic cavity actually lies the urinary bladder, lower part of the ureter, urethra, rectum, anal canal, sigmoid colon and some loops of the small intestine also. Okay, so if we say more specifically within the pelvic cavity, so this urinary bladder, ureter, urethra, sigmoid colon, rectum canal, anal canal, this will be the answer. Now then the most important structures in the pelvic cavity, these are the reproductive organs. In case of male, the prostate gland, seminal vesicle, vas deferens and ejaculatory ducts. Okay, so these are the male reproductive organs that lies within the abdominal cavity. Never say the penis and scrotum, because these are the extra abdominal organ. Okay, penis and scrotum, these are the extra abdominal organ. And in case of the female, what are the, these are the uterus, uterine tubes, ovary and vagina in the female. Okay, so in the pelvic cavity, the reproductive organs, that means genitalia, and some structures of the urinary tract, that means ureter, urinary bladder, urethra, etc. Now we already studied about the boundaries of the abdominal cavity. Now we will learn about the boundaries of the pelvic cavity. Okay, to understand the boundary of the pelvic cavity, we have to know something about the, we have to know some knowledge about the bony pelvis, that means hard part, so it would be more easier. But let's see. In the superiorly, the abdominal cavity is continuous with the pelvic inlet. Inferiorly, there is pelvic diaphragm. Posteriorly, there is some bony part, that is sacrum and coccyx. Anteriorly, there is pelvic bones, and laterally there is hip bones. Okay, how you can show you, there is no good picture. Okay, later we will when we will study the bones, we will show you. Now come to the, we will know some terminology about peritoneum and mesentery. What is peritoneum and what is mesentery? The walls of the abdominal cavity and most of the viscera within the abdomen, they are covered by extensive serous membrane that is known as the peritoneum. So the wall of the abdominal cavity and the viscera within the abdomen, they are covered by a potential serous membrane that is known as peritoneum. Okay, and in the thorax we studied about the peritoneum, that is parietal pleura and visceral pleura. So in the abdomen there is a same as serous membrane that is known as the peritoneum. Okay, and the peritoneum has two layers, visceral peritoneum and parietal peritoneum, and between the two layers there is a potential space, and this is known as the peritoneal cavity. Okay, so what is peritoneum? It is a serous membrane which lines the wall of the abdominal cavity and most of the viscera of the abdomen. It has two parts, visceral peritoneum and parietal peritoneum, and within these two peritoneum there is a potential space that is called peritoneal cavity. Okay, okay, now we will learn about peritoneum. So what is peritoneum? We already told you, it is a thin serous membrane and it is made up of a tough layer of elastic tissue. It is made up of a tough layer of elastic tissue and it is lined with a simple squamous epithelium. Okay, and it has two layers, we already told you, parietal peritoneum and visceral peritoneum, and they are separated by a potential space that is known as the peritoneal cavity, we already told you. And within the peritoneal cavity there is a thin layer of fluid. Thin layer of fluid is present within the peritoneal cavity. What is the function of this fluid? This fluid helps in lubrication between the two layers of the peritoneal cavity and as well as facilitates the movement of the abdominal viscera. So within the peritoneal cavity the fluid helps in the lubrication and allows the movement of the abdominal viscera. So we can see this is a very good picture of the pleura. So this is the anterior abdominal wall, this is posterior abdominal wall, and you can see this layer is the parietal pleura, and this layer, this is viscera. Surrounding the viscera there is another peritoneum, this is known as visceral peritoneum. Okay, visceral peritoneum. So this is parietal peritoneum and this is visceral peritoneum. Okay, so between the parietal peritoneum and visceral peritoneum, these area is peritoneal cavity. This area of the peritoneal cavity. Okay, this is peritoneal cavity. Now what is mesentery? Mesentery is nothing but the fold of the visceral peritoneum. Okay, folded visceral peritoneum is known as mesentery. So the folds of the peritoneum by which the viscera are suspended is called mesentery. So what is mesentery? The folds of the peritoneum by which viscera are suspended is called mesentery. And the parietal peritoneum and visceral peritoneum. The parietal peritoneum usually surrounds the internal surface of the abdominopelvic walls. That means the parietal peritoneum, it covers the internal surface of the abdominal wall and internal surface of the pelvic wall, and the visceral peritoneum, it surrounds the viscera. Okay, and actually the visceral peritoneum is a part and parcel of the viscera. It is attached with the viscera. Now it is a good we have to know a difference. What is the difference between parietal peritoneum and visceral peritoneum? Okay, look at that. The parietal peritoneum, it lines or it surrounds the inner surface of the abdominopelvic wall, and it can be easily stripped off. But in case of visceral peritoneum, it lines the viscera, abdominal viscera, that means gut, liver, spleen, etc., and it is firmly adherent to the viscera, so it cannot be easily stripped off. Okay, and actually this is a part and parcel of the viscera. That means it is tightly adherent to the viscera, and it is counted as a part of the viscera. Now the parietal peritoneum. Parietal peritoneum, it derived from the embryologically from somatopleuric layer of the lateral plate mesoderm, and visceral peritoneum, it develops from the splanchnopleural layer of the lateral plate mesoderm. And nerve supply of the parietal peritoneum is somatic nerves, and so it is sensitive to the pain, touch, prick sensation. But visceral peritoneum, as it is a part of the viscera, we know all the viscera has autonomic nerve supply. So the visceral peritoneum, as it is a part of the viscera, so it has also supplied by the autonomic nerves, and therefore so it is insensitive to pain, prick, or any sensations. Okay, so we have to know the differences. Now we have to know another differences, the difference of peritoneum in male and female. Okay, in case of the male, the peritoneum is closed and it is lined by the mesothelium, that is simple squamous epithelium. But in case of the female, it is different. In case of the female, the peritoneum is not closed. It communicates with the exterior environment through fallopian tubes or uterine tubes, uterus and vagina, and it is also lined by mesothelium as male. Okay, so let's see the picture showing the peritoneal cavity in case of the male and in case of the female. In case of the male, look at that, the peritoneal cavity is closed. It doesn't communicate with the external environment. But in case of the female, you can see the peritoneal cavity, it communicates via the fallopian tube or uterine tube with the uterus and vagina, and ultimately to the external environment. Okay, so the male, it is closed, the female, it is not closed. It continues with the uterine tube, uterus, vagina, and communicates with the external environment. Okay, so that's the basic difference between the peritoneal cavity in the male and female. Now we'll learn something about the mesentery. Okay, mesentery or some peritoneal folds. So many organs within the abdomen are suspended by the peritoneal folds. These organs are mobile within the abdominal cavity, and the degree and direction of their mobility depends on the size and direction of the fold. That means some abdominal organs are movable, they are mobile because they are suspended by the some peritoneal folds, and their mobility of the organ, the mobility of the abdominal organ depends on the size and direction of the folds. Okay. So what are the function of this peritoneal folds? The number one is it provides motility. It provides the mobility of the organs. Number two, it acts as a pathway or provides some pathway for the passage of nerve, vessels and lymphatics. That means nerve, vessels and lymphatics, they passes through the lymphatic parietal folds. Okay. And some abdominal organs, they are not lined by the peritoneal cavity fully. They lie outside the peritoneal cavity and they are known as retroperitoneal organs. And these retroperitoneal organs are fixed and immobile. Okay, so the organs which are covered with the peritoneum, that means intraperitoneal organs, these are mobile. They can these are mobile, but the organs which lies outside the peritoneal cavity, these are known as retroperitoneal organs. These organs are the immobile and fixed. Okay, actually what is called retroperitoneal organs? Retro means back and peritoneum means peritoneal cavity. The organs which lies back to the peritoneum, just posterior to the peritoneum, is known as retroperitoneal organ. Suppose this is the peritoneum, okay, and this is an abdominal organ. So this organ is known as retroperitoneal organ. So the retroperitoneal organs are covered only anteriorly by a peritoneum, but posteriorly there is no peritoneum. Okay, so the retroperitoneal organ are covered anteriorly by a peritoneum, but posteriorly they are free. But in case of intraperitoneal organ, that means those organs which are mobile, they are covered by the peritoneum. That means if it is a peritoneal organ, anteriorly and posteriorly they will be covered by the peritoneum or peritoneal fold. Okay, so what are the retroperitoneal organs? We have to know. So before going that, we have to know some organs at first they are intraperitoneal, but later on, when the time goes on, they becomes retroperitoneal. Okay, so from the process by which the abdominal organs convert into intraperitoneal to retroperitoneal is known as, the process is known as zygosis. Okay, zygosis. So let's see. Look at that. Some organs initially are suspended by the peritoneal fold, but later on they lose their mesenteries or peritoneal fold by a process, it's called zygosis, and then become retroperitoneal. That means at first they were normal, but when the time goes, they lost their peritoneal fold or mesenteries and become retroperitoneal. This process is known as zygosis. Okay, so it is a good picture of zygosis. At first, look at that. This is a primitive gut tube. That means embryologically there is primitive gut tube. Look at that. It is covered by the mesentery or fold of the visceral peritoneum, and the red color is the parietal peritoneum. When the time goes on, look at that. This mesentery or visceral peritoneum and this parietal peritoneum, they become fused with each other. And look at that, at last this primitive gut tube is covered only in the anterior aspect, and it become retroperitoneal. Okay, so the retroperitoneal means any abdominal organ that is covered anteriorly, only anteriorly, by a fold of peritoneum. Okay, so this is process of zygosis. So we have to know what are the retroperitoneal organs, or what are the organs that are fixed and immobile in the abdomen. So we can classify into two way. It is primarily retroperitoneal and secondary retroperitoneal. So secondary retroperitoneal means those organs which are at first intraperitoneal, but by the process of zygosis they lost their mesentery or peritoneum. So the primarily retroperitoneal organ are the kidney, suprarenal gland and ureters. Kidney, suprarenal gland and ureters. But the secondary retroperitoneal organs are the pancreas, except tail, duodenum, except initial 2 centimeter, ascending colon, descending colon, cecum and rectum. Okay. So what is the function of the peritoneal folds? We already told you. The number 1, it provides motility, and number 2, it provides passage of the vessels, nerves. Okay. Now we will know some other peritoneal folds, or the classification of the peritoneal folds. The peritoneal folds, we already studied about the mesentery. So what is mesentery? The mesentery is a fold, peritoneal fold, that suspend the small intestine. Actually, they suspend the small intestine. It's called mesentery. And the peritoneal fold that suspend the colon or large gut is known as the mesocolon. So the peritoneal fold that suspend the small intestine is known as mesentery, and suspend the colon or large gut is known as the mesocolon. Okay, same thing, according to the position their name is different. Okay, then another peritoneal fold is known as omentum. So what is omentum? These are another kind of peritoneal fold that connect the stomach with the other viscera. If the stomach is connected with the transverse colon by a peritoneal fold, is known as greater omentum. And if the stomach is connected with the liver by another peritoneal fold, is known as lesser omentum. And if the stomach is connected with the spleen by another peritoneal fold, it is known as gastrosplenic omentum. Okay. And there are some ligaments also. These are also some peritoneal folds. So what are they? These are the peritoneal folds. They connect different organs of the abdominal wall to each other. That means between kidney and spleen, it is known as linorenal ligament. Between liver and diaphragm, it is known as coronary ligament. And between stomach and spleen, this is known as gastrosplenic ligament. Okay, stomach, the another name is gastro. Gastro means stomach. So between stomach and spleen, this will be the gastrosplenic ligament. So these are nothing but the modifications of peritoneal fold, and at the different region they are named as different. Okay, so today we discussed about what we discussed about up to this lecture. So we know about the what is abdomen. That means definition of the abdomen. What are the cavities? That means abdominal cavity proper and pelvic cavity. What are the contents in the abdominal cavity and what are the contents in the pelvic cavity? And we learned details about the peritoneum. That is the male peritoneum, female peritoneum, and the classifications of the peritoneum. What is the function of the peritoneum, and so on. And at last we'll know about the regions of the abdomen. That is the 9 regions of the abdomen. So let's learn about what are the regions of the abdomen. Okay. So look at that. For clinical purpose, the abdominal region, the region of the abdomen, is divided into 9 parts or 9 regions. Okay, by the help of 4 lines. Okay, you can see the 4 lines, 1, 2, 3, 4. So by drawing this 4 imaginary line, the abdominal region is divided into small 9 regions. Okay, so what are the lines and what are the regions? We have to know. Look at that. So 2 vertical line and 2 transverse line. You can see the 2 vertical lines is known as the mid clavicular line. Okay, mid clavicular line. How to draw this line? You will draw this line at the midpoint of the clavicle above and at the midpoint of the inguinal ligament below. Okay, midpoint of the clavicle above and midpoint of the inguinal ligament below. Now the question is how you will identify the midpoint of the inguinal ligament. The midpoint of the inguinal ligament is the midpoint between symphysis pubis. Here is a bone that is called symphysis pubis, and here is a spine that is known as anterior superior iliac spine. Okay, so between the symphysis pubis and anterior superior iliac spine, the midpoint will be the mid inguinal point. So if we draw these two midpoint, this will be the mid clavicular line. Okay, so in the left side left mid clavicular line, in the right side right mid clavicular line. Then we'll draw two transverse line. One is known as the transpyloric plane and another is known as intertubercular plane. Okay, now how to draw the transpyloric plane? You will take a point at the suprasternal notch and another point at the symphysis pubis. The midpoint between these two points is known as the, if we draw a point and draw a line, this is known as the transpyloric plane. So the transpyloric plane is the midway between the suprasternal notch above and symphysis pubis below. And how to draw the intertubercular plane? That means this plane. It is drawn at the level of the tubercle of the iliac crest. While we know about the pelvic bone, you will see the tubercle of the iliac crest. So if we draw a line at the level of the tubercles of the iliac crest, this will be the intertubercular plane. Okay, intertubercular plane. And this intertubercular plane corresponds with the upper border of the lumbar 5 vertebra. Upper border of the lumbar 5 vertebra. And the transpyloric plane, this corresponds with the 9 costal cartilage, or you can say lower border of the first lumbar vertebra. Okay, so their bony level is the at the 9th costal cartilage, or you can say the first border of the lower border of the first lumbar vertebra, and in the intertubercular plane it corresponds with the upper border of the 5th lumbar vertebra. So by these 4 line, 2 vertical and 2 horizontal line, look at that, the abdominal region is divided into 9 parts or 9 regions. So what are they? Right hypochondrium, left hypochondrium, right lumbar, left lumbar, then right iliac fossa and left iliac fossa. And in the middle, this area is known as the epigastrium or epigastric region. This is umbilical region and this is hypogastric. So epigastric is above, hypogastric is below, and the middle is the umbilicus. Okay, so what are the regions and what are the these transverse line and vertical lines? You have to know very well. So what is the importance to knowing this the 9 regions of the abdomen? We'll later see in each region specific abdominal viscera lies. So if there is any pathology to the specific viscera, suppose in the right iliac fossa there lies the vermiform appendix. Okay, so if any patient comes to you with the complaints of pain in this area, so you definitely think about the appendicitis, because in the right iliac fossa the vermiform appendix lies, and the most probable diagnosis should be the appendicitis. Okay, so if another patient comes with the pain in the umbilical region, okay, in the umbilical region usually lies the small intestine. So if any patient complains the pain in the umbilical region, you will think about the any pathology in the small intestine. Okay, so the diagnosis will be easy. Now let's see. Okay, we already told you about the superior horizontal line. It is placed midway between the suprasternal notch and pubic symphysis, and the transpyloric plane lies opposite to the lower part of the lumbar 1 vertebra, and or you can say the coastal margin of the 9th posterior cartilage. Okay, and the intertubercular plane, we already told you, it lies at the level of the tubercle of the iliac crest, opposite to the upper border of the 5th lumbar vertebra, and the vertical planes or mid clavicular lines, it corresponds with the midpoint of the clavicle above and mid inguinal point below. So how will you find the mid inguinal point? Between the a point between the anterior superior iliac spine and pubic symphysis. Anterior superior iliac spine and pubic symphysis. The midpoint will be the mid inguinal point. Okay. So what are the abdominal viscera or contents in the 9 regions? You have to know specifically. Okay. So this is most commonly questioned, most frequently asked in the Fiverr. Okay. So we already gave you example. It is about the right iliac fossa. Look at that in the right iliac fossa appendix. So any patient come with to right iliac fossa pain, so you definitely will think about the appendicitis. So if a patient come with the right hypochondriac pain, look at that in the right hypochondriac there is liver and gallbladder. So you can think any pathology is related to the liver or gallbladder. They may be gallstone, they may be hepatitis or hepatic abscess. Okay, so you have to know all the contents in the all the 9 regions. We already discussed the clinical significance. Just have a look from this. Okay, so the abdominal regions, the dividation and what are the contents in the abdominal regions, you must have to answer in the exam. This is very important for both written and Viva examination. Okay.